So what do you think? Are our teens and young adults in crisis that is unusual? I mean, they're not great or easy years, right? Anybody who's a parent of a teenager knows that. But the violence, the addiction, the illness, is it different? Is it more? Is it worse? Or are we just dealing with the moral collapse that it seems our politicians can't talk about enough? In just a few weeks, what have we reported on? Mass shootings, violent teenagers virtually taking over a major city. Is this just about social media? Is this some kind of new mob kind of effect? What's going on here? Let's bring in board-certified physician, addiction specialist, host of Ask Dr. Drew, the man himself, Dr. Drew Pinsky. It's been a minute, Doc. Good to see you.
It has. It is really good to see you.
So, Doc, what do you see in this situation? Controversy or controversy?
Oh, the violence is sort of a separate issue, but there is absolutely no doubt that the mental health circumstances for young adults and teenagers in this country has deteriorated almost to an inconceivable degree, particularly the younger females, the amount of anxiety, depression, suicide, substance use. We've never seen anything like this. And at a time when we don't have enough psychiatrists, we don't have enough mental health professionals, there aren't enough resources. When I talk to my psychiatric peers, all they say when they talk to teens is they just hear anxiety, depression. And should we be surprised? It's absolutely predictable when you take 8 to 15-year-olds who are so completely dependent on their development and happiness on their peers, and we isolate them and we turn them loose on this thing for 2 years in many states. Are we surprised that they would deteriorate in terms of their mental health? And just as a sidebar, I do believe we will look at this one day as the same way as we look at tobacco now, but still we have not reached a consensus. It will get there. But yeah, they deteriorated, and of course, all the while they were alone, isolated, they were hearing from their politicians, shelter in place, which is, again, messages you tell somebody when there's a nuclear warhead heading your way. If they slip up, they're going to kill their parents and their grandparents. Are you kidding me? Of course, predictably, and it was extremely predictable when we started this, I've said it from the beginning, that the mental health situation for teenagers, young adults, particularly 8 to 15-year-old, would just fall out of bed.
What do you say to the don't buy it group, although they're a little conflicted because the don't buy it group also tends to be anti-vax or anti what was done during the pandemic, so they are open to the suggestion that somebody suffered wrongly. But the idea of, now you're just making soft kids, Dr. Drew. You're just giving them a diagnosis for what used to be called SAD, and that a kid who has ants in their pants and can't focus because they have no discipline now is ADHD. We're just giving labels to everybody, and that's what's driving all the problems.
Yes, I am sympathetic to people that say we clinicalize everything, we over-diagnose things, we over-medicalize in terms of the medications we prescribe. I am very sympathetic to that point of view, but I would ask them to please look at the problems with the kids functioning, the suicide, and the substance use. It tells the story. These are no longer just sad, or as you said, ants in your pants, uncomfortable, anxious young teenagers who are struggling. And by the way, if you took those same teenagers and put them in social isolation, would you be surprised if things got substantially worse? But okay, I'll accept that we don't want to over labelize these folks, but the reality is dangerous psychiatric consequences are emerging. Addiction is a potentially fatal disease. We're seeing suicide at an uncanny rate, and it is really the slope on that graph is still quite positive.
The phones are buzzing for you, Dr. Drew, and you're not surprised, or you shouldn't be. 1-844-968-7720. A treat for you on a Friday night. Dr. Drew, what do you got, Dusty?
We do. We have a lot of calls on this topic, and we have Sean from South Florida up first.
Sean, what do you got for the doc?
Question: how can we improve the social service agencies in place to help the kids' mental health right now?
Good question. What do you got, Doc?
Are you asking how to look? Here's you're asking for social services to be expanded. We need more psychiatrists. We need more psychologists. We need more residential treatment centers. We need more people board certified in teen and adolescent psychiatric care. We do not have enough. Particularly in Florida and California, we just don't have it. Social services, we have a lot of social services, but this has evolved well beyond the need for social services. Look at the homeless situation. There are armies of social service agencies on the streets. It's not changing a thing.
Hey, thank you for watching. Please go to newsnationnow.com, newsnationnow.com, and you can find NewsNation on your television provider. And don't forget to click the red subscribe button down below. Then you will get more of NewsNation's fact-driven coverage.